Hello and welcome to this short informational video on leg pain and swelling for the lymphatic massage therapist. My name is Kathleen Helen Listen, and I am board certified in therapeutic massage and bodywork. I'm a lymphedema therapist. I'm also an NCB/TMB approved continuing education provider, and I'm the author of Stress Reduction for Lymphedema. So we're going to talk today about why leg pain and swelling matters for the massage therapist, particularly the lymphatic massage therapist. And that's because many clients come to us as massage therapists from relief from their leg discomfort. But what's important is we need to know and be able to accurately assess what is happening when they are having the discomfort. And that will be the key to us understanding how to give them safe and effective treatment, how to give them a safe massage. So we'll start by trying to get our arms around the situation. And the important question for you before you decide to study this further is, how common are leg symptoms in your office? Are lower limb pain and swelling common complaints for your massage clients? Some people who are just do upper body, maybe they're doing lymphatic work after and helping people after their breast cancer. Maybe someone coming in and saying, hey, I'm thinking of getting a massage because I have swelling, I have pain in my lower legs. Maybe that's not a client you see. So this topic wouldn't be that important to you. But if you do see these clients, if a lot of your current clients are older and then they are talking about their leg pain and different symptoms related to their legs, this class might be very, very informative for you. It might be worth your time to listen and learn. And it's especially important if you don't really know the difference between muscular pain and then symptoms from potential arterial or vein diseases. And this is something that may have been only just briefly covered in our massage therapy school. So we learned the basic anatomy, physiology, pathophysiology, but it might be good now as a seasoned massage therapist, as you are, to kind of take that second look, take a little bit of that deeper dive, really understand what these arterial and vein diseases are doing to our clients' bodies, and then how we may be able to recognize some of the symptoms. And ideally, what I would love to do is have you learn about these diseases and then potentially be able to direct your client to the right person who can help them if they are coming to you first with pain, coming to you first with swelling, coming to you first with their complaints before they go to their doctor, or maybe they don't mention it in their annual physical. And then us as a massage therapist can point them in the right direction to get the referral, to get the diagnosis and potential medical treatment for their disease, to really help them live that longer, healthier life that they come to massage for. So let's look at some common diseases that cause symptoms in the legs. The first one is peripheral arterial disease, PAD. So PAD is caused by our arteries narrowing. So we can see that in other areas of the body. This is also what might be causing stroke in another area of the body, but in the legs, it causes a disease called PAD. And this is more common as people get older. It's important to understand this disease. And it's the arteries themselves are narrowing, which is going to lead to reduced blood flow in the leg. So typical signs would be their legs feel okay, but then when they exert, when they're doing exercise, when they're walking, that's when the pain really happens. And it can be called intermittent claudication. And they may also have shiny skin. They may have hairless skin. This is because of a lack of blood flow to the leg. And they may find that if they do have that cut on their leg, on the lower limb, slower healing again, because not as much blood is able to get into the area because their arteries are narrowed, and that is leading to reduced blood flow. The second one, the big one for me, because I go to a lot of conferences on this topic, I know a lot of venous surgeons, vein disease and chronic venous insufficiency. CVI occurs when the veins in the leg cannot return the blood efficiently, so that will cause edema, it will cause heaviness, it will cause skin changes. Um, and then this little picture of some like spider veins, telangiectasias. This is kind of like the canary in the mine shaft. This is a venous system that's refluxing. So if you're seeing signs like this, looking on your legs, looking on your client's legs, that's an indication that the venous system is not as healthy as it could be. So the third one, which I've had the formal training on as a lymphedema therapist, is lymphatic disease and lymphedema. So lymphedema is swelling from an obstruction of lymph fluid. So it may be because of a few different reasons, but it can lead to chronic edema. It's going to lead to thickened tissue, and especially in the leg where we also have, it's harder for blood flow and fluid to come back up from the leg. You could have skin changes and more thickened tissue and fibrosis for both primary and secondary lymphedema. The treatment of this should be handed to a massage therapist that's trained as a certified lymphedema therapist, or they can go for the copay to that outpatient rehab and get treatment from physical therapists or occupational therapists. And the final one we're going to talk about is loose connective tissue disease, specifically lipedema. So lipedema involves adipose tissue accumulation on the lower half of the body. And the different things that are going on with this disease, some call it a syndrome, is causing tenderness and bruising. It's often mistaken for obesity. So I love this picture of just the lady's legs. And I put this picture up so I can tell you we cannot just diagnose, we can't diagnose any disease, but nobody, not even a medical doctor, should just be diagnosing someone with lipedema purely because of how their legs look in a picture. You cannot self-diagnose just from a picture. You really need to take that medical history. There's more going on in lipedema than just I am bigger on the lower half of my body than the upper half. Let's talk about pain profiles. So what is the difference between these different diseases? What kind of stories are we going to hear from our client that is going to make us think, I wonder if this is what's going on. So if they have arterial disease, they're going to possibly talk to us about severe cramping pain when they have activity. So maybe my leg's fine, but then I start exercising, and that's a time when they're exercising, when they're moving the leg, more blood is trying to go in. They really feel the bottleneck of that arterial disease. They're getting those symptoms of intermittent claudication. Venous disease, exactly the opposite. It's the veins that are the issue, not the arteries. A dull, aching pain, worse perhaps with extended standing, especially if they're not in compression garments. This is the client that will say, oh my gosh, after a long day, I feel really tired, but all I have to do is, I just need to get on the couch for 5 to 10 minutes, just put my legs up, and then I start feeling better. It's this dull, aching pain, especially when they're on their legs, when that gravity is not helping the venous system return blood back up to the heart at all. Lymphatic issues, it's going to be edema, and the edema can cause feelings of heaviness or tightness. And these feelings of heaviness or tightness, pins and needles, these feelings can start before the measuring tape can actually measure that edema is making their leg larger. So they will have symptoms possibly of this increased leg volume before they see the difference in their leg. And then connective tissue issues, it'll be pain with pressure. If someone has lipedema, their pain is usually when they're touched, when there's a weight put on their lap, that is when the pain comes. And stories like, I can't have the kids sit on my lap. It's so painful to have a cat sit on my lap. It's just pain. I've had a client with lipedema and I was trying to show her something and I forgot for just a moment that there was going to be pain. And I gently pressed in my thumb on her tissue and she almost jumped off the table. And that is a very good remembrance for me that lipedema is causing this pain with pressure. Okay, a red flag, as we all know, and it's good to be reminded if someone comes in and they want a massage because they have pain, we need to ask about the pain because severe pain, sudden swelling, skin color changes, they have shortness of breath. This is an immediate referral to the emergency room. We're worried about a DVT, we're worried about a pulmonary embolism. What about swelling? What are the different swelling patterns? And I like this picture because there's a lot going on with this client that's getting her massage here in her legs. But they can have one or several of these issues. If they're having venous issues, the swelling is going to be at the ankle and the calf. They may have some skin discoloration. If it's more of a lymphatic issue, we'll see more swelling on the top of the foot, the toes, as well as the leg. So the lymphatic's going to involve the foot, particularly the top of the foot. If the swelling is going down to the bottom of that limb. This lymphatic swelling is going to be persistent and eventually it may in the beginning come and go. They may be able to elevate and then it goes away. It may come on gradually, but then eventually it's going to be persistent. No matter what they do, they elevate, nothing is going to reduce the swelling at the point where it's turned into a more severe stage of lymphedema. The swelling can eventually, the proteins can gather and then their skin can eventually be firm. You can see that pitting edema where you push your finger in for a while and then you can see a divot where the finger is and then eventually fibrosis will take over and then their skin will be very, very thick and then you'll see skin changes at later stages of lymphedema. So let's talk about skin changes, what to look for. And I want to emphasize, I'm showing you this picture. This gentleman has a lot going on, but this is not the only presentation of vein disease. This is lipodermatosclerosis. You can see the unique shape of the limb where it looks like an inverted champagne bottle. This is an advanced case of the disease where I would certainly hope that the medical professional in their life, their doctor, has seen this and diagnosed it. What I want to talk about is perhaps clients that are at an earlier stage of the disease. They still have the disease, but they're not diagnosed yet. So if they have arterial disease, they may have pale, shiny, hairless, cool to the touch skin in the calf area in the lower limb. If they have venous disease, they can have a brown discoloration. This is from the red blood cells, like the hemosiderin deposits on the skin. They can have itchy skin. They can have spider veins like we saw earlier. And this is like early signs that something may be happening that we could definitely refer them to a professional. If they have lymphatic issues, their skin can be thickened. We can see fibrosis that'll still generally be later after the edema has been there for a while. And connective tissue disease. For later stages of lipedema, you can feel fibrotic nodules. It may feel like grains of rice under the skin. It may be larger under the skin, these nodules. You can also see dimpling of the skin, and you can see an ankle cuff or like a cankle in some types of lipedema. They can still have lipedema and not have these symptoms, but these are some of the skin changes that we may see that I want this to like pique your interest and maybe start a discussion with should they go to their medical professional and talk to their medical professional about these diseases. And a common early sign of the chronic venous disease is the presence of telangiectasias, those spider veins, reticular veins In the presence of valve dysfunction, these veins are going to widen due to blood reflux. So the blood is going to reflux because of the venous disease, and then the veins are getting wider because there's so much blood reflux, and that causes these veins to become more tortuous and eventually transform into varicose veins. So if we can catch somebody when they have spider veins and kind of point them out and talk about how it might be a good idea to talk to their doctor about them, their primary care physician. This could be something that they could really research and understand that this is part of their leg health, and then have them seek to talk to an expert about it. Again, we're not diagnosing any disease, but we can tell our clients what we see. And let's talk about the four primary causes of edema. So when we're talking about swelling, swelling can happen for a few different reasons. And just doing a manual lymphatic drainage massage cannot cure all swelling. So we need to seek to understand what is going on. So you can have edema as a result of increased capillary pressure. So if there's increased pressure in the capillaries, it's going to want to push fluid into the interstitial tissue. That's going to cause edema because the blood capillaries are pushing extra fluid in. There's also decreased oncotic pressure. So there's not enough proteins in the blood vessels. So proteins in the blood vessels are attracting water because proteins want water. If there's not enough proteins in the bloodstream, decreased oncotic pressure is more likely for that water to not stay in the blood vessel. It could go out into the interstitial fluid and create that swelling that they're seeing. Increased capillary permeability. For whatever reason, the capillaries aren't as tight. And again, they're more likely to leak, like these nets that are broken. They're more likely to let things through. And then impaired lymphatic drainage. And that's the big thing that you see with lymphedema for a bunch of different reasons. It may be because the lymphatics were not formed correctly. So that would be primary lymphedema, or secondary lymphedema is for a number of different reasons. The lymphatic system was harmed either through trauma or the treatment for cancer. So medications can be a secret cause of swelling. Some drugs can cause or worsen swelling. It's important to always ask clients about the medications they're taking. And again, like I said before, lymphatic drainage cannot reduce all edema, especially if we're giving them a nice massage, but if they're still taking a drug that is causing their body to form edema, we're fighting a losing battle. They can still enjoy the massage that we give them, but they should be understanding that they need to talk to the person who prescribed them the medication and tell them that they're having the side effect of swelling. And it's important that not only to understand that not only taking the medication can cause swelling, but also stopping a medication that was reducing swelling can also result in them feeling more swollen. I had this interaction about 5, 6 years ago where I talked to somebody on social media, and they were suddenly coming up with, they didn't understand. It was a few weeks after their surgery. Suddenly they're having more swelling. They don't understand what they're doing wrong. They're doing everything that they need to help reduce their swelling. And so I said, what are your medications? Has anything changed with the medication? And it turned out that they usually take an acne medication, but because they were recovering from surgery, they had let their prescription run out. They just stopped taking their last pill in that prescription, hadn't gotten the new bottle yet, and they were seeing swelling because the acne medication was actually on a list that I had posted on a social media post of medications that actually reduce swelling. They have a reduction effect on swelling. So they were like, this is great. Thank you so much for sharing this list with me. They went and refilled that medication, and then they reported back that their swelling had gone back to normal. So not only there's lists of medications which cause swelling, but also to understand that some of the client's medications may be actually helping their body. Sex and gender are also differences that matter. Women are experiencing a higher level of these diseases than men. Women are at a higher risk for venous disease. Venous disease is more common in women. Lymphedema and lipedema are more common in women, especially overall lymphedema is more common because there's a lot of breast cancer related lymphedema. Primary lymphedema is also more common. And lipedema is extremely, extremely common in women. It's very rare for a man to have present with lipedema symptoms. Men have more symptoms that intermittent claudication from peripheral arterial disease, but it might be that more women, if you give a test to see what their peripheral arterial disease risk is, if you give them the test to see if they have the disease or not, more women have it. But if it's just people going to their doctor talking about symptoms, it seems as if more men are having symptoms of PAD. So preliminary data in chronic venous disease have shown how female patients present more symptoms in all age groups compared to men. It's very important to understand that chronic venous disease is not just an old man's disease. It's important for us to get this education so we can help our female clients as well. So red flags, when are we referring out? If someone has sudden onset pain or swelling in their calf, if they have rapid changes in color or temperature in that calf, if they have unexplained shortness of breath, that's a direct appointment with the emergency room, and they need to understand how important those symptoms are and how quickly they need to answer. They need to get medical help as fast as possible. So I have much more information on this topic. I hope this has just whetted your interest and you want to take this deep dive, you want to understand how to find places that you can refer your clients to, that the doctor, the specialist that will handle all these diseases. If you want to see pictures of these diseases at early stages, so you can kind of get an idea of what we're looking at. If you want more details and more research on these issues, I'll invite you to take this free online CE class, continue to go through the modules, and this was hopefully help you put the knowledge into practice so you will have a better idea of what you're looking at when you're looking at legs of your clients that are complaining of pain, that are complaining of swelling, and a better idea of what you're looking at when you potentially see some skin changes in the leg. We're going to discuss arterial, venous, lymphatic, and connective tissue disease symptoms. We're going to look at research on evidence-based treatments, what the researchers are studying as far as what massage therapy is safe, effective, and potentially can help peripheral arterial disease, chronic venous insufficiency and venous disease, lymphedema, and lipedema. And at the end, if you take the quiz, you'll earn continuing education. And I am an NCB TMB approved provider of continuing education. So I'll invite you to continue on with the class and get this information. And thank you very much. And I love this ending picture. It's a picture that I want to have you remind you of the importance of getting our clients back on the road, back to activity, and having them use their regular massage therapy appointments to keep them active, to extend their health span, to potentially give them a long and healthy life. So these are my resources. And all these resources, you'll see much more information on each of these resources in the class.